allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Start off looking for a motion on the minutes.
Second.
Any changes, amendments? All those in favor?
Aye.
Any opposed? Thank you. Let's scoot right to resolutions. HS1 is a resolution authorizing budget modification for the Department of Social Services Mental Hygiene to transfer balance of 2020 OPWDD state aid. And that is in the amount of $211,833. I'll look for a motion to discuss.
I'll second it.
Did you want to speak to it, Ellen?
Sure. Just a little bit of a background explanation. This is funding that sent to us from New York State Agency, OPWDD, for 2020, which were funds that until Oswego Industries did their final reconciliation for the closeout had not been paid to them. So initially, the funds were moved into a mental hygiene legacy account pending recovery from the state agency. But given the CFR, the Consolidated Fiscal Report, that ended up being submitted at the end of the spring, rather, Oswego Industries was able to show the expenses that warranted awarding them those funds. So the budget mod will allow me to move those funds back to the into the 2021 budget so that I can pay out in full their 2020 contract.
Okay. Any questions? All those in favor?
Aye.
Any opposed? Thank you.
Thank you.
HS2 is a resolution authorizing budget modification in the Department of Social Services to transfer funds into legal fees. For some reason, it's not in my packet. But, so I don't have the amount right in front of me.
It is $21,000.
Oh, it's on the back side, okay. I'll look for a motion to discuss.
Motion discussed.
All right, we're saving January, it's on the back side, so it's good time. Pretty straightforward. Did you want to speak to it at all, Stacy?
Unless anybody has any questions.
Okay. Any questions? All in favor?
Aye.
Any opposed? Thank you. HS3 is a resolution authorizing a budget modification Department of Social Services to transfer funds into adoption subsidy. $327,000 moved from other supplies and expenses and protective and preventive contracts.
I'll move it.
Second.
Any questions for Stacy on that?
I mean, this is good stuff, right, Stace? I mean, this is kind of getting through the backlog of the adoptions that
That's
were
correct.
hung up through COVID, correct?
That's correct.
And you're quite certain that'll get us through the end of the year?
Correct.
Great. Any other questions? All those in favor?
Aye.
Any opposed? Carries. Thank you. We're not stable together, so it's throwing me out there. HS4, resolution authorizing budget modification Department of Social Services to transfer funds into other equipment. So $24,000. This is the heap equipment that you're going
Correct. 100% federal money, no local share.
I'll look for motion.
Motion discussed.
Any second? Any questions? This should help you out. So I'll look for a vote. All those in favor?
Aye.
Any opposed? Thank you. HS5 is a resolution authorizing budget modification for the social services to accept federal grant for adult protective services. And that is in the amount of $28,266.
I move it, Mr. Chairman.
One second.
Any questions for Stacy on that one?
Is this all federal as well?
Correct, all federal, no local share, COVID-19 money.
Any other questions? All those in favor?
Aye.
Any opposed? Thank you. HS6, resolution appointing a member to the Community Services Board. This is Teresa Wilson for a term to expire 11/30/2025. Look for motion.
Motion to discuss.
Second.
I have worked pretty extensively with Teresa in during the anti-poverty task force work. And she's very active and knowledgeable. So I think she's a great appointment. Any questions? All those in favor?
Aye.
Any opposed? Thank you. HS7 is a resolution authorizing budget modification of for the Aging Disability Awareness Grant. And that is in the amount of $21,875 for disability awareness. No negative impact to the budget. Look for motion.
Motion to discuss.
Second.
Any questions? Do you want to speak to it all?
So what is this doing for us? It's got an advertising and reproduction.
Yeah, the grant was supposed to end in December of this year, but there's an extension into next year. So basically what we will do is create a toolbox partnering with OPWDD services on aging intellectual disabilities. So we can better educate the community to connect them to services instead of them just being automatically placed into nursing homes.
And if this was not a grant, how would we fund it? Or is it something that we would, or is it something we do anyway?
It's not something we've ever done before. The state they promoted it to us and we were one of the pilot counties doing it.
Okay. Very good.
Any other questions? All those in favor?
Aye.
Any opposed? Carries. HS8, resolution awarding professional services contract from RFP 21WD001, professional computer instructor. This is in the employment and training office.
Correct.
Look for a motion.
Motion to discuss.
Second.
This is someone who's already been doing this too.
Correct.
Yeah, okay, looks like a good deal. So any other questions regarding the approval of this?
Just quickly, this is one-time funding, Stace, I'm looking at here.
No, we have ongoing computer trainer who, you can't even apply for a job anymore without going
Oh, I'm
online.
sorry, Stace, I'm looking at the wrong resolution. We're on number 7, right?
Number 8.
Right.
So it's awarding a person who's come in but has historically provided this.
And this is the mental health expansion project we're talking about.
No.
Nope.
What are we talking about? Help.
Workforce investment.
Okay.
So we use workforce investment money, and they come into our one-stop and provide a very basic computer training skills,
I'm sorry.
like how to turn one on.
Yes, I support this. I'm sorry, I'm on the wrong resolution.
Yeah, no problem, but it's very relieving to hear there is actually a number 9 because Nicole and I just learned that it hadn't gotten into the packet from purchasing.
Yep, well, that's next, so
That's
let's
next.
finish this
Okay.
one first. Any
Yeah,
other
sorry.
questions about the computer trainer there? Yes.
How many days do we use it? $450 a day, so how many days should we actually use it?
Let's say in here, I want to say she comes in for 2 half days a month when things are up and running. I'm not sure we're using them at all right now because we don't have enough traffic coming through. You know, once a lot of people
It's kind of it's on an as-needed
It
basis,
is.
so it's variable. We don't exactly know what it's going to be.
But it averages probably 2 half-days or 1 full day, depending on our clients.
Any other questions? All those in favor?
Aye.
Any opposed? Okay, motion carries. Yeah, one more to sign here. Some more you, Brad. Okay. The aforementioned HS9, a resolution awarding professional services contract, RFP 21MH002 for mental health expansion project. I'll look for a motion.
Motion to discuss.
Second it.
Why don't you tell us a little about it, because this just got laid on our desk just before the meeting.
So this was an RFP to provide an opportunity for any of the 3 OMH licensed clinic providers that are operating in Oswego County to start up fund project to support them in developing additional capacity, primarily focused on adults who are in need of mental health outpatient treatment. This was to support people in either providing additional capacity within operating sites or to stand up new locations throughout the county. So it was provided to Liberty Resources, Oswego Hospital, and Arise, who are our 3 clinic providers. Liberty Resources was our only respondent. And they proposed 3 different projects, of which, since there were no other proposals, we had the funding available to support all 3. So they will be looking to add an additional clinician to their Fulton clinic and open a satellite office in Mexico in partnership with Farnham Family Services, who recently took over operations for Harbor Lights Chemical Dependency. So they'll be providing them a satellite office space for partnership in Mexico. And the third project is to open a satellite site within the Oswego City area to provide 2 full-time clinicians at that location. Overall, when they're all of those are fully operational, it'll provide capacity for an additional 200 clients to be served in outpatient services. And this is one-time just startup funding to help cover their operational expenses before to acquire physical space, recruit staff, train staff, and it takes a while to develop a caseload so they are able to generate billable revenue and to be self-sustaining.
Go ahead.
No, thank you, Sharon. So I'm looking at our backlog that exists, right? We're looking at 454 adults who are waiting from 4 to 20 weeks to access therapy or counseling services. We have 220 adults that are waiting access to medication management services. So we're creating essentially these 3 satellite sites through this New York State funding. Is that's going to directly go after that backlog that exists on the ground now, or?
Some of it.
Yeah, it won't. So, the numbers, the 454 awaiting counseling services, and then the 220 are a subset, are included in the 454.
Okay, not 2 different numbers.
Right.
Gotcha.
So some of the 454 also are in need of medication management.
Gotcha. But that's what we're designing these sites to go after, because we don't have the capacity right now
Correct.
to serve that, i.e. the waiting list. With these satellite sites, we're hoping. Do we have any, and if you don't know the answer to this, that's fine, because we're building it still, but is there any sense of a time? You talked about being able to bill and build revenue, actually building out the brick and mortar of the sites. Do you have any sense or any estimate on how long it may take to alleviate that backlog, or is that something we just don't know yet?
That I don't know, because unfortunately I would have to bet that the need continues to grow.
Right.
So even if we can put a dent in this number,
Yeah.
there's more people that are in need of services
Yeah.
all the time.
Yeah.
So, it's one solution to try to address the problem, but it's not the only solution. So additional community-based services will help people as well, and hopefully not need to be at high a level of care
Right.
in the outpatient clinic as when they start.
Yeah.
So that as they need less intensive services, it opens the door
Yeah.
to a clinician to take on another client.
And I had just a couple follow-ups. if
Yeah,
that's
go
okay.
ahead.
Just two more quick ones. Do we have a sense on when these sites will be ready to take in clients?
The Fulton site, they already operate in that location, and they have availability to expand and bring on an initial one. So, and they are already been started recruiting for that position. So if it's an operating office, they just need to hire somebody.
Okay.
The Mexico location, they will need to seek approval from the Office of Mental Health to have that new space licensed, which the space is available, the partnership with Farnham is ongoing. So that process with the Office of Mental Health for licensing will probably take about a month. The Oswego site, they do not have an identified site. They've been looking. They're currently looking and have had some leads for that. So
Okay.
the project, the expectation based on what the funding availability is that they expend the funds by June 30th of 2022.
Okay, that's good. And then this is my last one. Is, with the waiting list, what's the communication look like on the waiting list and with these clients that are waiting to receive services? So will we be contacting them when the sites are operational, or do we send out something saying, hey, we know you've been on a waiting list, and we know you're obviously expressing a need to come in and receive services. Do we put anything out to them saying, hey, hold tight, we're building out this capacity, we're building these sites, we want to see you, help is on the way essentially, or what's that dialogue look like with folks that are waiting to receive services?
The number that are waiting that's a collective count across the 3 clinics.
Okay.
So they're not all on Liberty's waiting
Gotcha.
list. So certainly when Liberty opens additional capacity, they're going to be reaching out to the individuals on their
Okay.
current wait list
Okay.
to try to move them in.
Okay.
They also have some folks that are seen in their Fulton site that they've already identified
Mhm.
who live closer to, say, Mexico.
Sure.
And they would prefer to get their care there. So there'll be some shuffling
Okay.
there. But
So really we'll be having that dialogue when we have the capacity to be able to bring them in.
yes.
All right. Thank you very much.
Do you want to promote the link to mental hygiene that is at the public website?
Oh, sure. So what Stacy's commenting about is that on the mental hygiene webpage of our county's website, we monthly collect information from providers, both for community services and for mental health and substance abuse clinics, that talks about their available capacity to take emergency and non-emergency referrals, whether or not they have open access. So if you visit the mental hygiene webpage, there's a community services tab, and then there's links to open what are PDF documents that list all the different services and the agencies that provide them their contact information and their availability to take new referrals. And that gets updated monthly from the providers.
Gotcha. Thank you.
Thank you.
Nicole,
Yes.
this is 100% OMH
Yes.
fund? Okay.
Mhm.
And so how do you think that, will this be able to go forward in the future? How many years does this cover for us right now? This
This is just a one-time shot. Essentially, these dollars are in the budget but available because of how everything got so screwed up during the pandemic process and some underspending from providers that has left this money on the table. It's not, at this point, a recurring project, recurring startup funding, like we did with the school-based mental health site.
So once it's settled and in progress, that we should be able to fund it?
It would become self-sustaining through Medicaid
Okay.
and health
Yes.
insurance. So until a therapist has a full caseload, they're not generating any revenue. So, and there's equipment costs and onboarding costs. That is what this is taking care of.
So this is really designed to help overcome some of those cost barriers to providers pursuing additional capacity. So this sort of takes that off the table for them and allows them just to hire staff and then supports them while they become self-sufficient for that employee.
Okay, any other questions? All those in favor?
Aye.
Any opposed? All
Thank
right,
you.
did 9 resolutions in 20 minutes.
For the record.
I'm glad they were DSS.
All right. Would anybody be opposed to adding the updates to the, and then go right to each budget, rather than going through updates and then heading back to that person? Okay, so, Matthias, you get to go first this time, with your department updates and then a budget review.
Okay, so, I spoke earlier, I'd like to make an addendum, account number, that's right, the pages. Yeah. Thank you, sir. A6510, 543800 for a subscription. That's an online.
Page 143.
Subscription is Death Row. So the subscription that we're talking about right here, the program is called Death Row. It's used for our offices to essentially load the program for our services for the veteran. We plug in all their basic information, and then that portal, that the service can be directly uploaded to the veteran, the VA essentially. So instead of going paper, we automatically, once we get a digital signature, we can just upload it. It's a lot faster, and it takes.
So this is a new line altogether.
No.
What was the number again? 543?
800, it's on
Oh,
page
800,
144, it's
yeah.
the last line on page
Yep,
146.
yep, I misheard the number.
That's okay.
Okay, so what's the actual change to that line? Good question.
It would be, so the two subscriptions total would be $900, but we're taking out the mileage to cover it for this year.
Well, that's your budget amount for this year.
So we're changing two lines then.
Just choosing one. If we put it to fees or other fees and services.
How much do you need that increased by?
So it was originally started to be, it was a free trial essentially, and
Yeah.
then once we found that. Right now, the subscriptions are, for two subscriptions for myself and coworker, is a $900 total.
So that needs to be 960 rather than 60.
And Vet Pro is the name of
That's
the
the program.
program. Does any of that come from potentially the state?
It's an ad.
So if I could, so we're asking a request for change, we're adding $900 under other fees and services, that would bring the total to $960.
Yeah.
We're on page 144?
Yes.
Okay, thank you.
Okay, did you, any other thoughts about the budget itself that you wanted to cover, or?
The office on time. Again, I moved just so we could get this covered for this year, for right now until we're on the option. So I'm looking into other programs that other counties are using as well, but for right now, this is what the corporate have in mind. So. And this is just gonna cover for this year for right now. So.
If there's others that you're considering, do we need to potentially up that then, other fees and services?
I don't think so. Right now, this is this is one of the more programs that a lot of the counties are using right now, so. It's one of the most
Just, thinking further down the road though, because throughout the year, if there's not a place where we can move it from, it'd be difficult to add to.
I'm trying to think of where else we can move that possibly, so, but again, without using the Pulaski office, and all that cuts the mileage to go into the Phoenix offices right now. The service that we've been using is phones, and that's how we've been able to do a lot of, and then the digital aspect of this, people can sign digitally, so that's where we can cut it out. I think we could still cover it, close to be very manageable.
But, yeah, something.
No, I just think it's fine to go with that.
Yeah, I mean, we're still below last year too.
Yeah, but I'm
Go ahead,
going
sorry.
a little reluctant to not anticipate having Pulaski office. Yeah, no, to be able to have money up there. I greatly appreciate, cutting back. You got a significant, change from, last year, but I don't want to short us either.
Are you talking about shutting the Plant Sky office down?
No, not at this time. It's just, we had there's been a lot of moving parts right now, so but as to keep the office working, we usually just be taking a lot of phone calls, and I've been able to do the job currently over the phone.
And there's only 2 of them in the shop right now.
So I hate to see the Plant Sky office closed.
I don't see it closing. It's just right now we're trying to.
You're limiting it. You're limiting the hours.
Exactly.
Yeah.
Two of them are employees and director. Mr. Chairman,
Yes.
I'd also point out that unless there's a director appointed in January, you can have vacancy savings that costs does go up if you ever drop from.
Yeah, I apologize, maybe I'm just not following this correctly. So I'm seeing a reduction in mileage, but I'm seeing overall in our 2021 adopted, the office sat at roughly 129,000 that was adopted in 2021. There was $121,000 requested in 2022, and the draft reflects 116,827. Where is that money been cut from in this budget?
It's in the, it's in personnel because with new people coming on,
Okay.
they're coming in at a lower rate than the senior people that were there.
Okay, thank you. Right, okay.
Okay, any other questions?
Motion and a second.
Okay. Well, I'll make a motion to amend the line on page 144. Yeah. 144, A651-543-800.
Yeah.
Increase from $60 to $960.
I'll make that motion.
I'll second it.
All those in favor?
Aye.
All right, I'll look for a motion on the entire budget then.
Can I ask one more question, Mr. Chairman?
Absolutely.
I'm sorry. So with our mileage reimbursement, we're reducing that $600. We're seeing an increase in, okay, so that's going to be, with the increase in virtual meetings, that's also because we're not able to staff the Pulaski office in full right now. That's because of limited hours at the Pulaski office. That's going to reflect a $600 difference. And the only thing I look at is like with virtual meetings, although they're continuing in a lot of instances, we are starting to open back up a little bit more. You're confident with $1,000 in your mileage reimbursement, you're going to be covered for the year. You're fine with that, taking that $600 loss.
Yes.
Okay. Thank you. That's all I have.
Look for a motion on the entire veterans budget, veterans services budget.
Motion to move to F&P.
Second.
All those in favor?
Aye.
Any opposed? Thank you, Ms. Hughes. Did you have any other updates about the office, or?
Not this time, sir.
We're not mentioning the DOI,
What's it?
the better of the year.
Oh, yes. So we're going to hopefully make a decision about this week of the year, Mr. Chair, for the veteran of the year, so.
We've had 7 submissions for veteran of the year, and those submissions have been distributed out to the committee that we formed for it, so we expect to have an answer by this Friday, and potentially to do proclamations by the 10th. It wouldn't need to be a resolution, but it would be a proclamation announced by the 10th legislature. So the 7 packages all look very, very good too, so I appreciate everyone that had input on that. And we did push it out there a lot, put it out to the legislature, so there were 7 very, very good packages, very competitive.
Good. All right, thank you. On to Youth Bureau. You want to provide us with your updates first, and then head right to your budget?
Sure. So November is National Runaway Prevention Month, and you're going to see that number 727 listed a lot. That's in 2020. We'll work with 727 youth under age 24. So that's the number they're working with. And with that, our Youth Advisory Council, which is made up of high school students throughout Oswego County, they are helping OCO this month with a collection of things for our program, for their program. So I'm just going to pass that around to have that go along with that. And then I'll just touch on a couple quick things and then get into the budget. And if you have questions, we can go from there. I brought Zach with me so he can obviously answer questions with that. As you guys know, earlier this year, you did approve the climbing tower that was built out to Hollis and then the swing set playground. That is supposed to be delivered on November 9th, but the install date is, to be determined based on weather and need of, or well, really what we can get for volunteers to help do that. Zach is evaluating some kitchen equipment right now that we have been told that may need some updates, and if we have some money left in our budget this year, we would potentially correct that and also make the whole kitchen more self-sufficient at Hollis. We have today, actually, bids are due for the ready projects at Camp Hollis and Independence Trail. So I think it's 4 o'clock today is when the bids will be coming in. We've had a lot of action on different questions and such for that, so I think there'll be a few to go through. We continue to work with Independence Trail with some different upgrades and developing of that park as well to be our third park to extend the opportunities and options that we have. I'm just going to give you guys a quick little thing that COVID still had an impact on us in the year of 2020. We had 16 events that were canceled between Hollis and Derby that were all COVID related. But overall, it's still, we still served almost 1,500 youth at Hollis and almost over 1,800 youth at Derby. So it still has some good numbers based upon all those different events being canceled. And going into 2022, we already have 19 reservations in place for Camp Hollis and 16 at Camp Derby. What's important about that is a couple years ago, you guys gave us the go-ahead to be able to start to accept reservations before that January 1 date, so that does give people the opportunity, and some of that maybe roll over some cancellations this year as well. This past weekend, just to kind of give you an idea of how things were, the Youth Bureau was involved in numerous different events. We were involved in both the Fulton and the City of Oswego trunk or treats, the Creepy Crawl downtown, and then Youth Night at the Laker hockey game. So altogether, just this weekend, we served about 4,000 of our young people, so giving them opportunities and things to do Halloween related that were safe. Our AmeriCorps program, so for the new year, kicks off today. And we did receive recently information that through the ARPA funding, we're getting an additional $57,306 for the program. And where that becomes important is, as you've heard talks all from many different departments throughout the year about the difficulty in finding, employing people and putting them to work. And with this, it will increase the money that a person working through AmeriCorps will get. So, for example, a 450 member hour of AmeriCorps, this year they received $3,548. With new ARPA funding, they will receive $4,200. So it does, give us an additional initiative to get young people, well, anybody really who's qualified to be an AmeriCorps member, to put them to work by doing so. So that's something that you guys will see come across next month, looking to do a resolution for that. But we're doing all our research and crossing all our T's and dotting our I's to make sure there is no local impact on that. We're getting all that information from the federal government right now. With that new year kicking off, we have new people kicking off the new year at Fort Ontario and Victory. They'll both be starting their new terms of the new year with AmeriCorps tomorrow. Different things coming up with the holiday season. My office will be involved with numerous different events, things from tree lightings to different collections and such going on through our students in all the school districts as we're slowly getting back into the schools, which is important. And then to give you guys an update, some of you who sit on our board, we've also had over 25 applications come in for funding for 2022. That comes through the state, and my board will be going through those with myself and my staff over the next month or two to look at, identifying the needs of Oswego County and determining what we want to fund for year 2022. So it's kind of busy with all of those things happening right now, and we officially closed Camp House and Camp Serby. They're both closed for the season. Good to report that we had no major issues out this year, no COVID-related cases or anything to that matter. So, knock on wood, got through another year of providing safe camping opportunities, and we're already well extended into 2022 as we get into the budget and talk about with our planning and advancement with continuing to grow upon where we were.
Go ahead, Tim.
I just want to highlight and thank again the efforts that you folks have put in over the last 2 years. I mean, to be able to offer even the limited services to our youth over the last 2 summers, the work you guys put in, to make sure it was safe and really to have, believe 0 actual cases, or at least 0 cases in 2 years. That's pretty incredible. So thanks again for all the work done. Please pass to your staff that we really appreciate that.
So we stay with the state. It's not like I'm a competitive person. If people don't know me, but I'm pretty sure we're the only camp with 0. Right?
In our county, yes.
Anyways. So going down that, when we get into budget, we can talk about it, but we do have different, see if the questions come up, with different plans for 2022. I know that talking to both legislative Yerdins that with Camp Serby, we have proposed to extend our camping out there to a 4-week program out there. Aside from that, we're also looking to partner again with the Teachers Association to do a STEAM camp out there, which would be an additional week or 2. And we're talking with the Sheriff's Department about a potential camp out there, and Zach will again follow up with the DEC that they do offer different camping throughout the state, and Camp Serby being an ideal location for that. We have construction that will be happening out there, including you guys last month, I believe it was, approved the updates at the Papa Malone building, which will put another building on the docket for revenue, aside from renting the lodge and the pavilion. The Papa Malone building will offer different opportunities, including year-round, because that building is heated and does have the opportunity for other meeting groups and such to meet at. So there's a lot of things on the docket going forward at Serby. We continue to build upon that, and as I mentioned, with Independence Trail, as you're aware of, like I mentioned, the new playground and such going in at Hollis, that Zach's numbers for the kind of programming we're going to offer next year are aggressive, but I think they're very, very reasonable to me. We didn't go overboard, but I think our expectations are, we'll be busy at all 3 parks in 2022. Now, I can answer questions as we go forward, or if you want me to keep reading through all my notes, I can do that. I think a lot of it will be questions as we go forward. My youth hero budget, before we get too far into it, I think I actually, by hundreds of dollars, not more than that, kept it under 2021. Veronica can correct me if I'm wrong. The major change, you want me to go into budget now?
Yeah.
The major, really with youth hero, the only big change that's in there, aside from things beyond our control, are I do have one staff person that I did request her job title change from a youth services specialist to a senior youth services specialist. Her role through COVID and beyond that has expanded to what opportunities are available and what they do and what's expected of her to do so. So I felt that met more of the criteria of what a senior youth services specialist does. And with this ever-changing world that we live in, just the asking of what we ask some staff to do, I felt that would be a better fit for that. And aside from that, I don't think I made any major changes in youth bureau, just little changes here or there, but we're pretty good at trying to, if we bump a line here, taking it from another line, and try to keep things as even as we can. With youth bureau, I did not, go beyond the means. I think for 2021, I tried to keep it as close to no change as possible. Yeah, I project more programming than 2021 with youth bureau. It's a set with changes from COVID, from some things that we've learned. We're able to reduce some costs here or there, and then just add them to different areas. So there were some changes that we learned from that we move forward with that we can work within our needs for.
So say that again, which is the position that you're trying to change?
The Senior Youth Services Specialist, so it'd be the third one down on page 158. I'm sorry, second one down on 158.
So it's a reclassification, is that?
Correct.
No, and that didn't make the reclassification page.
Youth Services Specialist, going from 20.94 an hour to 24 an hour. So it's already in the resume.
Okay.
We're also able to, as we go through, and there's different programming that we have that we're able to get different outside funding sources in our revenue line to offset for some of our programs. For example, the PROMS program is new, yet there are other funding streams involved in that either weren't as high in 2020 or 2021, or we're not there at all. So we were able to do that. Our Leadership Oswego County Youth Program, we did find a new sponsor for that as I came to you guys earlier this year. Hillside now is the sponsor for that, so there's more revenue. So some of our traditional programming we have or we're expanding upon, yet we have found outside sources to help cover those costs. We got more money from the city of Oswego this year, sorry Tim. So we're able to offset some costs. They contributed money to the PROS program and such as well, being that program is mainly in the Oswego Middle School this year. So the city of Oswego added money to that as well.
Is that under local source?
It should be. The city has they have their own area. The city is down on page 160, 161.
161,
161.
reimbursement from City of Oswego for staff expenses, youth activities. Got it.
And the city's budget's passed already, so that money we know we have for sure.
Any other questions? I'll look for a motion on the, so do we have to can we do these all together, or since they're on different pages and under different,
I think we usually do them separate.
Yeah.
Oh, the other thing I was going to mention, nobody asked, but our AmeriCorps program is obviously under Youth Bureau, and the funding changed a little bit within there too. And then with that being said, when I come to you guys next month, sorry Veronica, I feel like we're difficult, but it's really on a positive side. If we go through and accept that ARPA money, then that would be more money coming in, but it'll balance.
Depends on how you want to word your motion. If you want to do it all in one motion, just say approve the Youth Bureau and all the budgets that it administers.
okay.
I would make that motion.
Do I need to have one to Parks and Rec?
Pardon me?
I don't have one to Parks and Rec? That's about as accurate to that. Parks and Rec is where the majority of our changes were.
154.
Well, yeah, we're having you do your highlights here, so.
Yeah, so with Parks and Rec, and Zach, I'll let you jump in whenever you want to, we're pretty, we're pretty happy with where we are at with what our plans are for 2022. Zach worked hard, we worked hard too with our accounting department, and the three of us worked hard to really look at what we're missing and what we're projecting and what we need to do. And there were some important pieces that are moving that help the overall county budget. For example, we look to restore the CIP program. And with that said, I don't know if you want to explain the benefits to.
Yeah, so there was a casualty of last year was our counselor and training program. It's for 15 and 16-year-olds and hopefully get them to be counselors one day. A benefit, one of the perks, one of the good things that came out of COVID was our day camp program. We took that up to 40 kids plus per week, and was at the max end of what we could have done this year, or excuse me, 60 kids per week. Knowing that when we go back to overnight, our day camp is going to be hopefully just as big. So our overall number of kids that we're going to be able to accommodate is going to be even higher. That's why Brian mentioned that my goal for next year is significantly higher than it was in 2019, which was our last normal year. So with our counselor and training program, we're going to be calling junior counselors. And at age 16 with day camps, they do count into ratio. So restoring that $1,000 per CIT will help count with our day camp ratios, but at a significant less cost than what a counselor would be. So bringing in 4 CITs would cut costs and just staffing needs. But then with the increases in with other supplies and expenses, just to reflect food costs, additional training, that's why that number is higher. But really, I think looking back to 2019, and I don't know if that's in this book, it's really just bringing things back to kind of where they were out at Camp House specifically, prior to COVID, and that's what we're trying to get back to. And knowing that some expenses are going to go up because of more kids that we're going to be taking on.
Well, an increase is due to the minimum wage increase.
Correct. Yes, and the staffing costs across the board, just about every one of our staff is at that minimum wage rate. That went up another 70 cents from last year for just about everybody.
The good news is, knock on wood, with staffing, even though others ran into that last year, we didn't have a real big hard problem with staffing House. We actually had people hired that we had to let go once the governor kind of put the end to summer camping last year and then brought it back at the 11.5 hour. That we had full staffing and we're in good shape for next year too, that the key positions that are difficult to find, the nursing and such, we already have people lined up for. And that's the tough part, because you remember years and years ago when you can't find nursing, you have to have nursing to operate camps. You just can't be open without them by state regs. So we have things like that already in place, and as Zach said with the CIPs, they count for ratio with staffing, so that staffing we do not have to hire. So they actually benefit from not only being a learning piece, which is what we're looking to do, but also covering for rations and such, et cetera. So we have new things happening at Camp House continuously, and I think that with where we're at, I think we'll be in a good place, and our expectations are January 1 when we turn on the light to start taking camp reservations for both Zerby and Hollis. I think things will happen. We've worked with legislator Yurden a little bit. He gave us the lead on a name of a person interested in assisting at Camp House or Camp Zerby, and hey, you know what, they don't even want to be paid. We have to talk to them about that, but they don't even want to be paid. And we're looking to work with that person to do part of our recruiting in your area to get the ball rolling in early January and such, to get the people signed up to run a camp and then put it together so that Zach will be able to extend his time in both places and get both camps running at the same time. Which I think will be important to do so. So we have a plan in place. All the pieces are there. It's just literally putting it in motion. We have it all ready to go. And going around the construction that's going to be going on, because Hollis has, again, they have the Ready project and the CFA project that both logistically could be going next summer or after summer. And then Camp Zerby has some work to be done out there as well. So we're going to go around those schedules, but able to have everything ready to go.
Okay, so Brad made a motion.
I did. Motion for the youth bureau programs and programs administered by the youth, move to F&P.
Second. We have a second. Any other questions for Brian? All those in favor?
Aye.
Any opposed? Thank you. Thank you. All right, Stacy, thank you for your patience.
Knowing that you may have lots more questions for the ESS budget than anyone else, might I suggest Oswego Industries is here for the budget. I didn't know if we wanted to let our guest kind of cut in line here, or?
Sure,
It's not changed.
it's way at the beginning, right?
Yeah, page 2. $35,000.
Yeah, we just have a one line there
Yep.
that we see. Do you, so, hi there, why don't you introduce yourself?
Hi, I'm Caitlin Durantire. I'm the Corporate Compliance Officer for Oswego Industries in the heart of Oswego County.
Do we have a page of their budget? We had one last year, but is it basically the same?
They're emailed out to everybody Friday. They can get your copy if you want.
Yeah, I'm not sure I saw it.
It's why. Yep. Why?
Yeah, if you don't mind. Why don't you tell us a little bit about what you use the money for while you're here?
So any money goes towards supporting our employment programs for Oswego Industries. So currently, we are in the process of, we've already done this actually, we've transformed our workshop into an integrated business model per OPWDD guidelines. So any additional support of growing those projects is always appreciated. I know that the county used to provide significant funding for some of our workshop programs, but it's a much smaller amount now. So, and I actually haven't seen the budget numbers, I just came to answer questions.
Okay.
If there were any.
Well,
Yeah.
I mean, I would think that if you really, had some specific needs that you wanted us to take a look at, you'd want to send them to us, earlier
Yeah.
in the year.
Yeah.
And, we could,
there's no-
we could entertain them. We've basically just kind of seen this single $85,000 line, for probably 4 years, I think, at least.
It's 85,000.
Yeah.
Can't wait to know what we're doing.
And, certainly understand you're doing good work over there, but if there were specifics that we could look at to help you out, we might be able to, in the future, do a little bit more.
Okay.
Go ahead, Tim.
Is that the only one of the page 2 that is in this committee?
That is the only page 2 item under this committee.
Okay. So I wanted to recommend too that with the county in the process of setting up its process for the way we will be evaluating the American Rescue Plan funds, it would also be probably prudent for OI to take it back that there might be an opportunity there to partner with the county as well. We're obviously still working our application process internally, but there could be potentially some funds there that could help go along with some of your other funds. If you have some specific projects that would make sense. So just wanted to kind of put that away.
Okay.
Has that been on your radar at all? Do you have any?
I mean, we've been looking at funding from HCBS waiver grants and some different federal fundings and the FMAP. Is that, would that be in reference to
Two
the
different things.
FMAP?
Yeah.
Okay.
American Rescue Plan has very specific guidelines, but it sounds like some of it would be applicable.
Specific-ish is the correct word.
And it would also not be a yearly thing, it'd be like a one-shot deal for the branch.
Right.
Mm-hmm.
Although, we have until like 2026 to disperse all the funds, so it could potentially be a multi-year deal.
Yeah, but it would be for one drive you could.
Right. When it ended, it would end.
Yeah.
The funding
It
would
would
be
be
correct.
And it is limited, so it needs to be done.
But there's also there's also additional pools of funding that could be available as well. And so if whoever would make sense in your organization wants to reach out, Dave Turner is overseeing that here in our office.
Okay.
It would be a great source of information to see if there's additional funds, even outside of the one we've already been awarded. Your organization just got to.
Happy to release those now. Again, you should. Okay.
Tim?
That's what.
Yep.
Mr. Chairman, I have a question.
Absolutely, go ahead.
Does,
That'd be great.
I guess this is a question maybe for the committee. When the Oswego Industries, do we receive an annual report from them every year through this committee? I'm trying to remember.
I don't think we get an annual report, but they're required in their application to describe how the use of their funds, how they used it the previous year. And there's a funding agreement that they have to sign. Same with all authorized agencies.
I'm trying to think how to word this. We've been out to Oswego Industries. We've done a committee meeting out there before. We've walked around. I've seen the work that's done out there. I know a lot of people that have interacted with the agency. So please don't take this as a critique, so to say, but there's good work going on there. But I've been on the legislature. This will be my last year, 6 years. And for some reason around Oswego Industries, it's always this kind of awkward dance that we do, so to speak, to where it always seems a little bit awkward, just because, and maybe some of that's on the committee, maybe some of that's on Oswego Industries, but it seems to be kind of a blanketed number every single year. We get a 2 or 3 page report, and then we don't really hear much from Oswego Industries for the bulk of the year. So I guess my only critique would be, moving forward, I think the committee would be curious to see how these programs are implemented on the ground and how they're being run effectively. Maybe on more of a frequent basis as opposed to kind of once a year here where we kind of sift through this, and it always seems to be just a little bit peculiar when it comes to Oswego Industry. So I guess I would just encourage more dialogue, not only on our end but on your guys' end as well, just to help educate us on what we're funding.
In other words, you'd be welcome to come and report to us
Right.
anytime.
100%.
At a committee meeting.
100%. Yep. Thank you.
So how did you, I know you put your transportation out to a new vendor last year. How did that all work out this year?
We're back with OCO.
No.
I know. So that's how it went. It went poorly. So we're back to this county opportunities.
Okay, well, that's interesting to know,
Yeah.
because that was, we fund OCO, so last year there was a little bit of trepidation that, okay, we're going to fund something that now is not going to go to our own bus system, so to know that it's back
Yeah.
is nice to know.
It's at a much smaller capacity. We're just running 6 buses. Prior to COVID, we were at 12 with the previous vendor, so about half as much transportation currently, because we don't have everybody back 5 days a week. So.
Okay, we'll pass the word on that we'd be interested to hear from you more often, maybe a couple times a year.
Okay.
They'll report on how things are going and programs that you have going. And I guess I'll look for a motion.
And again, I will answer any questions. I wasn't entirely prepared today. I found out at about noon that I was coming here, so and it was my day off. So, so I apologize if I'm not prepared.
No, from my end, if I can, Mr. Chairman, I just don't know the questions to even ask. That's kind of where I'm falling on. And please, this isn't your fault by any means. It's nobody's fault really. There's got to be a better line of communication, I think, with the legislature moving forward. Unfortunately, you can pass the message for us, in my opinion. I'm not going to be around, but I think it is a good move moving forward.
Well, I mean, it's like 1% of their budget,
Right.
$85,000, all right? I mean,
Right.
if I did the math right, maybe that's 15% or 1.5%, something like that. But
And I can tell you what is not funded by other programs is employing people with disabilities. just in general. So we employ probably 50 to 100 people with disabilities, both in Fulton and at our sites, our custodial sites. So, you know, the funding kind of goes to supplement like the free job coaching, you know, the stuff that we just kind of do for people with disabilities that work for us also.
Legislator Stahl?
But to be very clear, the specific funding that we give, the 85,000, does not go towards anything other than transportation, correct?
Oh, correct.
Okay. So
Correct. But, you know, it just kind of
Right.
allows us to.
The reason I asked, we passed a new internal requirement that any of our page twoers that fund salaries in any way need to provide statements of proof of salaries and contracts, and there's none of that here, so I just want to make sure that
Oh, yeah.
truly
I'm
is,
sorry.
that's more of an internal question than anything. So just wanted to make sure. Thank you very much.
Yeah. I guess I didn't understand what the budget, didn't look at page 2, sorry.
Okay,
Need a motion?
yeah, let's, go ahead, we need a
I
motion.
make a motion to approve that.
Motion to move to FFB?
Yeah.
I'll second.
Any other questions or discussion? All those in favor?
Aye.
Carries. Oh, any opposed, sorry. No, hearing none, we'll pass that portion of the budget on to F&B. Thank you. Thanks for coming on your day off. Sorry about that.
Yeah, it sucks.
Okay.
You don't have to stay, you don't want to.
Yeah.
Okay.
Yeah, especially since it's your day off.
Thank you.
Thanks for your forward. Should be here.
I know. On her day off.
Okay. That was nice of you, Stacy. But now we're back to you.
Alrighty, I reported out on ERAP last month, and the state has shut down ERAP for new apps, saying that all of the monies have been asked for. Now, that doesn't mean that they're all going to end up funded. There will be people who do not finish up their application.
And ERAP is Emergency
Rental
Assistance Program.
Program.
Yeah,
Correct.
they finally opened it up to landlords to be able to apply, and that, so the money evaporated very quickly after that.
Correct.
And that makes sense.
Now, it could get more funding, but my hope for, it was gonna save us maybe a little money next year, because otherwise it comes out of part of our budget for emergencies that have a local share to it. So I'm still going to hold out hope that perhaps some more federal and state money will come into that fund. We ended up with just a bit shy of 900 applicants. So, you know, we'll see where we go with that. There has been a lot of movement with Governor Hochul. I think 5 different commissioners were asked to resign, leave the state. One being Michael Hine, who's the commissioner of OTDA. That's who got this ERAP up and running and oversees all of our financial assistance. So there's a few others that have somewhat of an impact on us when it comes to policies from the state down. Remember, we're state supervised, locally administered. So the state really sets the rules, if you will, for us all across the state. Which is why nobody really gives better benefits in one county than another, because it's kind of all the same rules apply. We also continue for legislators request for us to kind of look at who's moving into our county from out of county and getting on public assistance here. I mean, I can report this out more to you if you want. or do something at the end of the year, but again, we're kind of finding the same thing we found in my last report out. Most people are from here. If they're not, most of them are coming back here from outside because this is where they started their life. This is where their family is. This is where their kids are, that kind of thing. So,
So you're finding they have a connection.
they have a connection, yeah. Yeah, now, there's a handful that don't. Sometimes they're coming out of county. There were 2 this month, 1 last month. So when you go to state prison, you go back to the county you were arrested and sentenced in. And so sometimes that happens, and until, if they're on parole, it takes a bit for them to be able to then come back to Oswego, which was where all their family is. So it kind of depends. We find that a lot with some of our citizens who end up either in Watertown, Rochester, or Syracuse. We have had a lot of people coming out of prisons and jails the past year and a half that we've had to locate housing for. Pandemic related, trying to keep their census low.
Stacy, could I ask a question on that, or just?
Sure.
If that's okay, Mr. Chairman. I think that's an important report. I mean, I think, I'm not telling anybody in this room anything, right, but that's one of the uneducated stigmas out in the community, right, is that people are coming in droves to Oswego County because of the public assistance, because of the public assistance programs. It's not just based in facts or reality. So, and frankly, there's people in this legislature that hold that sentiment, to be completely frank. So, I think that report being made available to not only the legislature, but even to the public, is important because, dealing with folks out and about, it's a misnomer that's out there that's just not based in any sort of fact. So thank you for doing it. I'll be interested to kind of dive into it a little bit, but being able to get it out to the legislature for education of not only our elected officials, but out to the community as well, I think is important.
Okay.
And that's all I'll say.
Okay.
Thanks.
Can I follow up on that question?
Go ahead.
Have you seen, Stacey, obviously we don't know who leaves here and goes to other places. Is there any sort of statewide tracking system? I mean, that sounds a little crazy, but you know where I'm going with this. I mean, it's something we're doing internally. We know who comes here, but we don't know who goes there, right? Is there anything that you work with some of the folks at other counties to get numbers, maybe not individuals, but numbers to get an idea? I mean, obviously the benefits.
state does not, actually, there's nothing in our WMS, there's nothing that allows us to get state data on this. The way I'm getting this information is that when people are applying or surveying them, we're asking them. So who moves and goes other places? If it's something where they've been on assistance in Oswego County, we get connected to pay the first month. That's where the county fiscal responsibility for that case until things are established in the new county. But other than that.
Does that kind of intake survey, is that only those who have a permanent residence? Does it include the emergency use ones, maybe where they just kind of show up? This theory that there's this bus that comes in from every other county of our state and just kind of opens up and dumps people in Oswego, right? That's some of the conversations we've heard.
If you ever hear that, let me know. I've sent my fraud investigator out to motels to question people and then bring that report back so that I don't assume that that's some myth.
Sure.
I did that, I think, was it the Knights Inn or something like that?
Yeah, a number of years ago.
Yeah, there was a busload of New York City folks that got dumped there according to the report, but indeed there was nothing like that. So, I'll always I'm happy to send out one of our social services investigators, our fraud investigators to.
Well, all this started because New York City had some little chunk of
Yes.
money that they supposedly were supplying tickets to people so that they could
Yes,
leave.
Broome County had a real issue with it, I know. No, we have not, we never received any big amount from New York City to relocate their people here.
No, so that, Tom is right, that would be an important piece to share with legislators and the public.
Okay. Our foster care, onto our foster care, that's, number continues to be somewhat stable. In September, we had 190 kids. What hasn't been stable, what has been escalating is a great concern to me. And that is kids who are institutionalized or in residential care. We now have 20. If you recall my report out last month, typically we were seeing single digits. But with FIPSA, we all know what FIPSA is. Hopefully I briefed you enough over the last year and a half. It was rolled out in New York State as of September 29th. So I'm just about a month out, and it is very unfortunate that this rollout continues to shift, as far as I'm concerned, more and more risk and cost to local share. I was really counting on us being able to get more 4E money for preventive services. They haven't even come up with codes or any way for us to see if we can increase our investment in preventive care. What they have done now is they have increased the number of QIs that go out to assess whether a kid is actually meeting the level of a residential facility. Because, of course, the law is least restrictive setting. Now they're going to be doing this prior or at the time of placement every 6 months for kids over 13, 90 days before the kid's permanency planning, for the long stayers, they call them. So this might be our kid who's down in Pennsylvania because there was not a center who would take her here in New York because of her behaviors and developmental disabilities.
Stacy,
Mm-hmm.
just, I don't mean to cut you off, but the 90 days prior to a permanency, what's the total time you can have without a permanency hearing?
There is, so we usually go in at 15 months.
Oh, I thought it was shorter than that, because the 90 days, I thought it was only like 6 months or so. I thought it was much shorter than that.
Yeah.
Okay.
But it's going to be frequent with these kids, and once they say to us, this child is not at a level, does not need to be in a center level, we have to get them back in the community in a foster home or a purchased foster home. And you can't turn around and say, well, we can't find a single foster home that will take this 17-year-old who has a long history of violence. That's not enough. Or to even say, we don't have enough foster homes, period. We can't get them back into a foster care setting. So what will happen as a result of that is that we'll lose our 4E money on those residential center placements. And it just made my stomach flip again. It's just very, they're really in many ways setting us up is the way I feel. I've been really outspoken on these WebEx conference calls with the powers that be at the state level because they continue to shut down OMH facilities. If OMH runs it, they're called facilities. If Child Welfare runs it, it's called centers. Child welfare centers do not have the kind of psychiatric expertise that OMH facilities do. And many of these kids, especially the kids, just got another call today that end up in emergency rooms and they can't get them out of the hospitals. And expressed that to you, I think, a few months ago. We're just not, we're not finding places for these kids. And again, OMH is just closing them right down. OPWDD closed theirs down a while ago, and really, we can't get an OPWDD placement. Is that fair to say, Nicole?
Yeah, well, they have a small co-occurring disorder special treatment in partnership with OMH in Buffalo. It's very small, but that's part of their, FMAC block grant projects that are in their report is to pursue opening another one of those, possibly in partnership, a small one in partnership with Upstate. But that again serves a large catchment area. So it will, like the Buffalo one, be very hard to access once it's operational.
So I'm taking in more voluntaries because we can't get Article 10s and these parents. We can't get family to take them. We can't get a neglect or abuse petition through. Parents are doing what they can do with kids who are really challenged by their psychiatric and or developmentally disabled condition. So more and more is just being umbrellaed under this big child welfare umbrella. But the fact is, in my mind, and I think made a good justification to the state, it's just a cost shifting. So stay tuned.
Can I ask a couple questions about that, Steve?
Absolutely, Tom.
Just so I can make sure that I understand it correctly. So, what we're, and I don't mean to bring it directly to finances because there's a whole host of other real world issues that are obviously going on with these folks. But to make sure I understand what we're at risk for from a financial standpoint is because we can't place these kids. Is that the right word? Because we can't place them, we're at risk for losing some of our preventative services money. Do I understand that correctly?
Losing 4E money is the 50-50, 50 federal and then 50% state local.
Okay.
That is only for placement costs, foster care costs, until September 29th.
Correct.
Then we were able to actually bill 4E for preventive services. So the vision is shift all that money we're spending on a residential placement,
Right.
beef up community-based services, and keep those kids either home or in our community through foster care placement.
Okay. If we can't place them, then we run the risk of
no 4E money because we're in a higher level of care, which would be any congregate care, agency-operated boarding home, group home.
Okay. I just wanted to wrap my head around that.
So the only one that is exempt from a 4E not being able to get 4E is the Committee on Special Education Placements. You know, CSE, no, that's our Committee on Special Ed, CSE. Those placements, School for the Blind, School for the Deaf, some ED, some emotionally disturbed kids. Those, we don't have to go through all these hoops. But JDs, which are placed through Dow, the county attorney, and probation, that's in our budget, that's all under that. So any of those kids placed.
Okay.
And it's unfortunate, they've actually raised the age beds in half. They had this whole cadre of raise the age beds that are therapeutic. What's happened though, because I think overall across the state, we have our own particular issues in our neck of the woods here, but across the state, law enforcement said, we're not going to really take this and run with it. They're not going to jail and getting punished. There was kind of a hands-off. So a lot of kids who were in jail historically, when it came to the raise the age, all of a sudden, whoosh, the bottom fell right out. And then the pandemic hit.
Okay. That helps, thank you.
And that wouldn't have been under mine with 4E and all of that.
Right.
That would have been under raise the age, the
Oh.
state made.
Can I just mention that, Brian and Matthias, if you want to go, you're okay. We can check out what the deal. That'll be a little while, all right?
We've already checked you guys' box.
I know how fascinating I am, but
It was interesting, and it's just,
Yeah.
You're welcome to stay.
And the state is owning up to what it said it would on having beds available 24/7 for adolescent offenders. We had a problem with a kid from the other side of the county, Central Square, came to Oswego, fired a shotgun through a residence when someone was sleeping, and returned, was arrested. We wanted that individual put into a bed because of the risk posed to the community, and it took quite a bit to find a bed and secure a bed for that individual. And Stacy's point on these residential treatment facilities, the state has been pushing kids out of these facilities. I think some of you will recall a few years ago, we were in Supreme Court in Syracuse with a girl that was being released from Hutchings and was supposed to be transferred to an OMH facility, but they didn't have any beds available. They basically said they were going to drop her on the door of DSS, and she had threatened her parents with physical harm, needed further treatment, and unfortunately the problems that the department's facing are not unique to Oswego. They're widespread.
Well, while we're on that, Stace, how does this affect your budget predictions?
We came up with that budget over the summer. Lots have changed. We did up adoption subsidies, although I'm not sure we upped it enough. I thought 24 kids was somewhat just a spike because of the court. I'm not positive that's the case. Now, we're only looking at 2 kids coming out of there for aging out next year, and yet I see maybe 15 kids who look like they probably are going to end up free for adoption over the course of this year. So we may be a little short on adoption subsidy. And as far as the 4E and all of that, I can't even wrap my head around how to begin trying to project that number. We're going to do backflips to be in compliance. To choose the right QI is going to be a biggie. Some of these counties that don't have the right qualified individual going in and understanding the child welfare system and understanding these families, I think we're in a good spot for that. We've got 3 who are, one is just retired as the director of services in Madison County, old colleague of mine, and she's an LCSWR licensed and teaches up at SU. We've got 2 others out of the child welfare programs in Syracuse that are very savvy, understand what we're up against, understand these kids and their needs for structure and their needs for treatment, things that, behaviors that would be unsafe in a foster home. The state's pushing things like, we'll find a foster home with no pets in it, because they used to abuse pets, and find a place maybe without a male in there, because males seem to spark this kid. And I think, so you're going to leave a single female foster parent with who? They'll do better in the foster home. You wait and see. They'll do better there. Maybe they will, maybe they won't, but I'm not taking the risk. I can't put people's safety at risk. We'll make the best decisions we can make, given these constraints. And keep in mind, this is federal laws coming down to the state, although I gotta say, New York State has interpreted them in the most conservative, most constraining way. Like, we didn't have to have just QIs that were licensed clinicians. They did that because they thought we could then bill Medicare for these assessments. Can't bill Medicaid for these assessments. And then just say, oh, well, forget it, we're not gonna get treatment. I mean, that's why you do an assessment as a clinician, so that then you can provide treatment. You know, this is just crazy talk. And there's caps to all this. How many sessions can be billed under Medicaid? On and on it goes. There's a lot of complications here, folks. I will be watching it very carefully, and keep you posted. Although I have to say, the watchers in this usually came out of our fiscal, and we are, just to give you a quick update on staffing, we are starting to build back a bit. I welcomed 10 new staff in this morning at DSS, so I was pleased as punch to do that. We're building back
Better.
slowly. No. Better isn't when you see walking out 30 years of experience. You know, that hurts. We have a lot of institutional knowledge, and you guys know that because you were part of celebrating these folks who are leaving us. And some of you, they're your friends and constituents. But we're building back with new eyes, new energy, but lots of training to do. We came out of the freeze somewhat unscathed in Veronica's old unit, but since we actually filled the two positions, but now those folks have been seated very short amount of time, and they're going on to other jobs in the county system. But they kind of, I don't know, went from typist to, I don't know, one went to a account clerk someplace. We've got our director still vacant. We believe there might be a possibility of internal promotion that was not qualified back last June, but may be qualified as we proceed here. I will be asking next month to have a salary set through F&P on that, and the hope and prayer that that person, who's very solid, I know Veronica was pleased as punch to hear that we might be able to get this person qualified through HR for this director position. We are now, though, looking at down 2 senior accountants, or only 2 senior accountants. One is retiring in March, so we actually thank you for approving the about 3 months of training. That's in our employment and training, all that, millions of dollars that come to us, federal dollars through WIOA, and not finding a lot out there. We had scrambled and then didn't really find anybody, and then HR said, no, we can remove you have to have 2 years supervising others. We'll remove that, see if that opens the door up a little more. We've posted for a senior accountant. We ended up being able to, we actually ended up getting 3 to come in, saying they'd come in, and now 2 have withdrawn. So we have 1 scheduled for the guy who's retiring. And then I thought the other senior accountant was going to stay in place, but she's opted to take another job within the county. So went to a different department.
Stacy, well, on your new hires, how many came in right to work and how many are in training?
All of them end up having to train.
Okay.
There isn't anybody that we can just put right to work. Yeah.
Okay.
which is a really heavy lift for the people left behind.
Yeah.
So now we're down really 2 account clerks, a typist, a senior account clerk, and a director in our 14-person fiscal. So I let Phil know there could be some balls of draft. There's not much we can do. We'll do the best we can. But Gail's going to the other department. We're going to be able to have her work 2 days a week from now until the end of December, and then we won't be able to use her time to train someone. So I won't have somebody in place by then. Marty and I will pick up on the contract stuff. We're starting to parcel some things out. The senior accountant, we have 5, when that position was vacated, we have 5 different people who have taken pieces of that job. So we've got things parceled out in a way that's clumsy with the workflow. We're doing the best we can.
Just a question with that, this, I don't know, this might be a naive question, but, and I'm assuming because of all the training that gets involved with these positions, but is there any type of third party or outside agency that does this type of consulting work that could come in and work with you guys as a bridge, so to speak, until you're able to bring on full-time employees to get the department up and running again? Has that ever been considered? Does that even exist?
It doesn't exist that I know of.
Okay.
I think all other counties, most of them are struggling like that.
Yeah. Okay.
It would take someone knowing munis.
Mm-hmm.
There's a munis in a lot of places, but not.
There's not an
county.
agency though that does this type of work. Yeah. Okay. I was just curious.
No. Okay, budget. We want to go. Was there anything else? Anything anybody wanted to ask?
Nope.
Okay.
You want to do Nicole's first?
Yes.
Okay, I got it's on page 113.
Nothing too terribly earth-shaking about our hygiene budget. The internal operations are pretty much the same. There's a few shifts around based on some of our change in operations of more virtual work using a little more technology, which shifts some of our supply and equipment expenses. The staff is stable. I find a piece of wood because I think we're the only ones that can say that we have not.
Yeah.
That is true.
Not lost anybody. Nobody's planning to go anywhere. Of course, we're not very. There's only 5 of us, so I guess that's not that hard to accomplish. But so the budget actually is less local share than it was last year. We have some additional funding that's coming in that's also going out in our contract lines. Primarily, there was some changes due to COLA, plus we are receiving an additional $100,000 from Oasis to support substance abuse treatment in the jail. So that will give us a total of $160,000 to collaborate with the Sheriff's Department and with Farm and Family Services to figure out how we're going to spend those money in the best way possible. It's not open, last I knew, to outside providers to come into the jail. So we had to scramble during the pandemic to get an approved plan from Oasis to serve criminal justice involved individuals with substance abuse differently on an outpatient basis. So we still have to go back to the drawing board to figure out what that might look like going forward to spend the additional funds. There's some changes in the contracts structure based on local needs. We currently have a fee-for-service RFI out through purchasing to look at an alternative structure to mirror Medicaid services in the children and adult systems that will hopefully fill some gaps for those individuals that are not enrolled in Medicaid or eligible for those specific Medicaid services. So leveraging some of the Medicaid services that already exist with our local providers to be able to expand those opportunities for other folks. So that'll be new next year. You see, hopefully we'll get a decent response to that RFI, which is currently open. I don't know if people have any specific questions?
Any questions?
What?
Yes, Tim.
And I apologize if you already touched this on your update. Unfortunately, I wasn't able to be here right away, so I'm sorry I missed it. But one of the things we had talked about a couple years ago was with the school-based mental health offices that we were looking to do some upfront funding with the understanding that they would become self-sustaining. Is that what we've seen? And I know there was a bit of a hold off because of everything with COVID. So if you already updated, we can catch up later. If you have not, would you be willing to give a little update on where we stand?
Yeah, I can give an update. And they're actually in the process of gathering some survey information, which also came as a request from this committee some time ago, but waiting for an opportunity with the schools to be able to give that some attention. And using that to actually bring a report back to this committee. But I can tell you that is, although it had a delay in any additional development due to the pandemic, it is back online this fall. So we have, since we started this particular project, we have added a half-time site in the APW junior senior high school, half-time in their elementary school, which will cover that district. It's just the 2 buildings. We have middle school and high school in Mexico. We have Phoenix Elementary and Middle School. Separately from that, no, those are Liberty Resources Development through the startup funding. Separately from that, with some development, Oswego Hospital moved out of Central Square High School, and Arise picked that site up. So Arise has Central Square High School, Middle School, and 2 elementary schools, which leaves 2 elementary schools yet to be developed, one of which is fully located within Onondaga County, and maybe Arise participates in their school-based development, and so I'm not sure if they look at that. Fulton is entirely covered in every building with Oswego Hospital. Oswego Hospital is in 4 elementary schools in Oswego City, the middle school, and now the high school. And they're also in all 3 buildings in Hannibal. So we're continuing to make progress with that development. Some positions have had some turnover that they've been able to, but they're, for the most part, stable staffing. The newer programs are continuing, especially the ones this year, developing their caseloads. We have had difficulty and expect we'll have continued difficulty in recruitment for clinicians for Sandy Creek and Pulaski, because they were one of our Sandy Creek, Liberty did try to do some work with and try to do some recruitment in order to move forward on opening a site. They had absolutely 0 interest.
Who had 0?
Sandy Creek had, or Sandy Creek, the school district at that point was interested in the program, but they could not recruit anybody. They didn't get a single applicant.
Was that to be was that to be a school employee, or was that to be an employee of the
agency, Liberty?
Okay.
Would be their employee. Since that time, Sandy Creek used some of their own rescue plan funding to hire somebody.
Well, that's kind of where I was going with this, is because up until 3 years ago, I don't say we're the only game in town, but it was definitely not the schools. I don't think had put as much of an importance into it, and so these school-based mental health offices were kind of, outside of some. They didn't have the school-based social workers in many of our school districts that now with CARES Act funding, with ARPA funding, and talking to, I had a couple phone calls last week with 4 of the school superintendents, and 3 of the 4 mentioned that they would hire 3 or 4 or 5 more mental health counselors, more social workers. The funding's available, they just can't get enough people to do it. And so I'm just curious, that's the same pool really as our mental health counselors for our school-based. They overlap quite a bit. So I'm just curious, are we seeing, and they pay a lot better. I mean, the reality is school districts can offer far better benefits than those from the not-for-profits that are housing these school-based mental health offices. Maybe not way better, but you're in your state retirement and all the other benefits that go with it. So I'm just curious if that's something you are seeing. Is that a concern? I mean, with all the CARES Act funding and ARPA funding out there, there's a ton of positions open across the county for school employees. Does that pull from the pool that we have from our school base?
I think it's still, I wouldn't necessarily make that connection. I think the issue when the recruitment in the Sandy Creek is due to the location. And that was an issue before all these other funding opportunities came out, so it certainly wasn't, they weren't competing then. And Sandy Creek, I'm not sure what they use, some of the funding they have, what qualifications or scope of work they attach to this person, but have since turned around and said, we still need Liberty to come in and open a clinic. I think there's still different levels, there are different intensities and levels of care based on what a school employee as a social worker is going to provide than an home-age licensed clinic. Just like with the Connects Care's mental health component from the school-based health centers, they're designed to do similar things but on a different level of intensity. And so I think there's still room for that. People are competing with the same number of employees, which is why Liberty didn't sign on to say, I'll open a site in every building that left, all at once. That's why it's a...
Right. And I think the big point is if our hope was that these would become self-sustaining, and that was our discussion. We have upfront funds to be self-sustaining, but the caseload is necessary in order for it to be self-sustaining. If they're having trouble finding, do we end up in a place where we still need to help them going forward is really the question. It's more of a funding question.
Well, aside from the establishment of this satellite, if they don't have a clinician in the position, they don't really have any cost. So there's that piece of it.
If they haven't done that yet, does that mean we still have funds available because we expected them to? So could this potentially spread out longer if we needed to?
We reimburse the actual costs on all our contracts.
Yeah.
If there's a vacancy with one of our nonprofit providers, we don't reimburse them.
Right, and the demand for the service, so that's one of the things that's happened with APW, so it's a fairly small district, and, it's a small district. They had a full-time clinician established in the junior high school, and it was not fully utilized, so they have available capacity. So working with the district, the plan was to split that person across 2 buildings. And should they they demonstrate use and need for that, and each one of those full-time or half-time cited buildings could become full-time. But this way they don't have somebody that they're paying full-time that doesn't have the referrals to generate the revenue.
Sure. And this is Liberty you're talking about, right? Because I know Connects Care is also in those buildings as well, doing the same thing.
Yep.
Okay.
And Arise.
Yeah, in different districts, or different buildings.
Different buildings.
Okay, thank you.
Other questions?
So what was the problem with Pulaski?
Pulaski, we didn't reach yet. So there was a strategic plan because they could do 3 sites a year, and we essentially asked the districts to arrive at some consensus of what school buildings would be prioritized. So they decided on that amongst themselves. Pulaski would have been last year, and they I don't want to say declined, but they said given the pandemic, they really were not in a position to take on a partnership and try to figure that out to bring that on into the building. So they're still in the mix, but we haven't made any effort to stand up a site in their building yet.
When is the effort going to be made?
Well, they run on school year calendars, so the next opportunity would be to July of next year. So they're July to June contract years for the service.
That's just through Liberty though, right? Because they do have Connects Care.
Yeah, I was going to say.
They have,
Connects Care.
Yeah.
that is just for the satellite licensed mental health clinic, a clinician in the building. One, and then subsequently, depending on how, that's one, right? One building.
Maybe 2
Or
buildings.
2, Sandy Creek's one building.
High school and elementary, 2. St. Creek's L1.
So ultimately, the goal is that we will stand one up in every school building, including the city BOCES locations.
Thank you. Any other questions? Look for a motion on the mental health budget.
I'll make the motion.
Second.
To move to F&P. Any questions? No. All in favor?
Aye.
Any opposed?
Thank you.
Thank you.
I just want to point out with the mental hygiene budget, the county is really doing well here. 4.9 in expenditures, 4.7 in revenue from all other sources, and 146,797 in county funding that is contributing to mental hygiene across the whole county. So, you're getting a whole lot for a little bit of skin in the game on there at 146,797.
That's why it passed so easy.
And we would not bring all that in if it wasn't for this lady right over
Well,
here.
thank
She
you.
makes it sound easy, it's not.
No, it really doesn't make it sound easy.
All right, good.
It's
Good to hear.
It's a big challenge.
It is. It's a complicated bureaucracy dealing with all those O's. We call them the O's. Oasis, OMH, and OPWDD.
Thank you.
Thank you.
So where do you want to go next?
Employment and training? Is it, should be
That
another
is
piece.
175.
Page 175, correct. And here's another one where, we have very limited local share. There's a whole lot of federal money coming in.
I mean, according to this, there's a 0 local share in the 22 draft for the first part of the budget. Right? And then
0 in the
Workforce Investment Act.
Yeah, that's right, because the part of employment and training where you do have local share is on my side of the budget. So, yeah.
Okay,
So
so-
this side of the budget has 0 local share. Does anyone have any questions for me about any of these expenses?
I move this for discussion, Mr. Chairman, for the
Second.
motion.
Okay. And do you have any questions?
I do not.
Does the budget, when we talk about this and you see it here, all of our health insurance benefits are obviously pulled in a separate location in the budget, right? So does that mean offices like this that we looked and see have no local share? Would that be reimbursed in this budget or separate?
That's a bit of a complicated question. It's something that has come up very recently with our cost allocation plan cap. And I don't, I would really welcome you and the treasurer to the table when Vanessa comes in and reviews that plan, Phil. We've got to give back, what is it, $1.5 million? Because of this pooled money, they tell us it's 67.
That's the personnel services line, is that?
No, it'd be in.
Because we're
HR's
self-insured, we have it's all at the bottom, we have that separate.
It's not included in fringe, gotcha.
Right.
It's very clumsy. I've never seen it set up like this. I don't understand the benefit to it. If there's a benefit, we should keep it the way it is for the county, but if there's no benefit, it jams us up. It jams up DSS. It makes it a lot more.
What was the question? I was out of the room.
If there's local share in the benefits that are in the HR budget, are we able to get reimbursed? And the answer is yes, but it's complex. It's not clean. If it was right in our budget, it'd be clean.
Could we just just for future purposes, couldn't we just handle some sort of internal transfer of the amount that is allocated to DSS, which would then put it in the DSS budget so there's a line? Is that how it's done, or is that how
Well,
it's done?
it'd be a little more complicated than that because you'd have to take it, DSS, you'd have to put an expense line in the DSS budget for other benefits.
Right.
And then when the cost allocation plan is done, that revenue source from DSS to HR would have to show.
Sure.
So you couldn't just start doing it, you'd have to do it with the plan in place to reflect in the cost allocation plan.
Well, it's something that I've been discussing as long as I've been here, is that I don't love that each department does not have an allocated health insurance cost. It should be in there. When we talk about the cost of an employee, we aren't actually viewing it, because there's this giant pool of money at the back end of it that includes every employee of our county, so it's not actually broken out per department. So when we, for example, did away with the department a few years ago, the actual savings was greater than the budget of the line, because it also included the individuals that we no longer had to pay for from our health insurance fund. It's not a huge amount, but health DSS is much larger than that. So to truly understand the cost of an employee and the cost of a department, you need to include the cost that is not currently being associated with those departments and those lines.
But in order to know that, since we are self-insured, you'd have to know how sick an employee is going to get.
Yeah, I mean, you could justify it by the total amount of employees divided by the total cost and come up with a percentage.
Well, they must not have paid out much, because we were paying HR and put in for $1.5 million, and now we've got to pay it, well, a lot more than that, but $1.5 million of it's going to have to be paid back to the state now, because we didn't spend as much as what was predicted. If it's just every month we got our bill, so to speak, and we just claimed it, it would be good and clean.
Mhm.
But right now, it's just based on a percentage, and the last one was pretty high, almost 70%, 67 point something.
62.63, and now
Okay.
it reduced to 54
And it reduced to 54.
for the whole year of 2020, so that's why it's so.
So do they need actual experience and actual costs in order to reimburse it? Is that the issue? So
Now we can do it on the cap, but
The cap is an estimate of what they think your expenses are gonna be. And then when they do the reconciliation, once you have all the expenses in order, then that's the reality. So you have to go back and unclaim what the estimate was.
does that, so when you say the actual, is that the actual for the DSS employees, or we're talking about the actual expense that our whole county incurred, and then they do a per employee broken out?
That's
Okay, and that makes more sense. I can't
But it
imagine they would.
is, but it is
Yeah.
based on the number of
Actual
employees with each department, yes.
Okay. So we kind of already are putting that together. To be able to show that in the budget would be a little more transparent, I think. Or,
I think it'd be hard for you to come up with the accurate.
no, it wouldn't be hard at all. All you have to do is take the total expenses divided by the total employees, how many employees are each department, you tack that on there, and you get a very fair estimate.
well, going back to the
Going
back to the ENT
It's gonna
budget,
fluctuate.
any of the costs that we have
The
in the
budget.
ENT budget with benefits would be reimbursable under our federal NOAA grants, correct?
Yeah, but in the ENT budget, they do put other benefits. They do carry the other benefits in the ENT budget.
So those are specifically carved out of the self-insured line at the end?
Yeah, ENT reimburses HR, I believe, through a journal entry each month. So they're one of the few departments that actually carries the other benefits. They have a line for it.
But I'm assuming those are not exact, though. They don't go find the 15 employees, check and see how much they actually cost, and then reimburse that amount, right?
I'm gonna be honest, I've never asked Bill.
Can't
Bill
imagine
Martin
they would
would
do
be
that.
the one that knows exactly how.
Boy, I
much.
guess I didn't even know that.
Yeah, it's on page 170.
Well, if ENT can do it, I would love for DSS as a whole to have that same piece to it, 'cause it just
Yeah, that was done because the,
We will
it's all federally
require-
funded, so we wanted the benefits to be federally funded. So we broke
And
it.
WIOA requires it.
Okay.
That's why it's done.
Gotcha. Okay.
The city does something very similar with the way they handle their HUD office, so that's why I was curious about that.
So, why don't we see any numbers under the Workforce Investment Act? Is that what we see totals?
Because we don't put it in there until we get the allocation.
So, okay.
So it's done that way.
Can we move, so do we move everything under 629 and 6293 together, or?
Mental hygiene and ENT?
No, we already did mental hygiene. This would be, employment training group is 629 group, and then 6293 is the Workforce Investment Act.
Move it all in one? Is that which one?
Yeah, we can just, why don't we just move both?
I'll make that motion. Which one?
So it's Employment and Training and Workforce Investment Act sections, the budget. You have a second?
Yeah, I'll second. I think Brad did.
Any other questions? Okay. It's one of the parts of the budget that pays off the most, I'd say, right? In a lot of ways. For workforce
It does
development.
in Oswego County because we put a tremendous amount of triple FS money in there, as well as the WIOA money. Triple FS actually could be funding other things. I don't know of another county that has no local share, no county investment in their employment and training, in their one-stops, and I don't know of anyone that does that, but that's what we do, so.
That's what we do. All those in favor?
Aye.
Any opposed? Which section do you want to do next, Stace?
MMIS, page 138. I don't know if anyone has any questions on Medicaid.
No.
I only have questions on Medicaid.
Leave it to Tim.
So, I mean, those are not questions that will be answered in this room.
Now they're much higher.
That's right.
I move it for discussion, Mr. Chairman.
Second.
Any questions? Okay, all in favor?
Aye.
Any opposed? Okay,
All right, and lastly, DSS.
so 116.
116, correct. So we are asking for some new positions. We've asked for a new DSS attorney. And
Say something additional, when you say new.
that's a brand new additional attorney. We right now have 4. I'm asking for a 5th.
Okay.
Full-time, yeah, full-time position. We had one gal out for FMLA. Now we've got a second gal out, another attorney out that will be even more extended, probably 2.5 months. So longer than FMLA. So we're having a really difficult time recruiting someone to pitch it for us. We are not able to prep our caseworkers for court. We don't have the capacity, which was one of the things I really needed to have done because 42% of our caseworkers had less than 2 years' experience, and their testimony on a witness stand is typically what will win our case for us. So we have no presence of an attorney at the DSS building in Mexico when things pop up in other areas, adult protective and financial assistance and fraud. Those are add-ons, and we clamor to try and get attention paid to them. We're really lucky that the county attorney picks up on our lawsuits and those kinds of pieces, HR pieces, Christy picks up on. But our DSS attorneys, we're in 6 different courts, and we are hard pressed to keep up with it. I'd like to have one person as a coordinating attorney so that person will report to me and be able to bring back the team's concerns or issues right now, it's kind of snatch and grab it for me.
I thought they didn't want to do that at first, so.
We're not going to have a real, it's still going to be run kind of like a law practice, but so we won't have one attorney that actually makes more than everybody else. You know, they'll all be on a level playing field with that. And we also will be able to, I think, rotate that depending on the needs of our.
So your
our
proposal for the new one brings them in at the rate that these are currently?
at the base rate,
78,000.
which is what we brought the other ones in.
Oh, okay, there, so.
Some of them had already been here.
No, we haven't moved the whole thing for discussion yet. I mean, do you want to, when we can, if you want, go ahead and move the DSS budget for discussion?
Sure.
I'll second it.
Okay.
So we're asking for that.
Well, there is a page in, right after the brief at the beginning that has all of the reclassify
Yep.
and create positions.
Okay.
So it states it's a DSS attorney, senior caseworker, and senior accountant. That's what we're seeing on our page.
Yep.
All right, well, we went from upgrading a typist to a senior typist. This is for Gidget, who has taken on a tremendous amount, took on fraud unit. Before I came, there was a administrative services, and Marty was the director of administrative services, and then was promoted up to a deputy commissioner. All of that administrative services, which was the clerical, the reception, all of that ended up umbrella under Gidget. So Gidget really has not been able to be successful in having a typist who can provide direct support for her, because those typists just keep changing. They can earn a lot more in the school districts. That tends to be where we lose typists.
So which one is this that
So
we're
this is an upgrade from a typist to a senior typist.
Okay.
So that probably, so that's a new one. An upgrade from an administrative services assistant to a senior administrative services assistant. So this is who does all of our HR-related functions and payroll and all of it.
So these are reclassifications.
The typists and the administratives are
They're not new
reclassifications.
positions. Okay.
Correct.
So
They're not new, but they are listed under the new. And then another reclass is the Director of Assistance Programs. Everyone except, every director at DSS other than the Director of Assistance is at a SG 50. Yet, this Director of Assistance is at an SG 40 and is supervising and has oversight to a lot more of our assets, revenue, and staff than other directors. I meant to fix that a while ago, and it just got off my radar. But as I was really looking at the details of all of our directors' salaries, so I'm asking for that upgrade to an SG 50. Is that even in that page?
It is.
It is? Okay, good.
yeah, so it's
I
taking,
didn't look at those, to be honest with you.
taking it from 71,280 a year to 74,810.
Yeah,
That's what we had. And agreed 50, right, okay.
yeah, 3% of that is the regular OCPA increase. No, 2%. It's like a 2%?
The increase was 2%.
Okay, OCPA's 2%, so then it's an additional 3%. It was a 5% increase. We're adding a senior caseworker. So, you know, we had a little more experienced casework staff. Some of our seniors could supervise 6, 7 caseworkers and do. But with so many caseworkers, not having a lot of experience. We need to, and frankly, our seniors. You know, you can take that senior test after you've been a caseworker for 2 years. So some of our seniors, our supervisors, are still learning. They're still wrapping their arms around our field. So I want to try to reduce as best I can to a 1 in 5 ratio, which is what is child welfare standards. And then we'd like to upgrade 2 community services workers, or 2 typists to community services workers that are direct supports to Child Protective Services team. These are the folks that receive all the SCR reports and triage some of them into MDT. They're really at the heartbeat of our intake process, and so we'd like to upgrade those 2 typists.
And we already did some of those this year, didn't we?
We did upgrade typists to community services workers and services rep. These are 2 existing. We did it when they were vacant.
Okay.
So these would be 2 existing typists that we'd like to upgrade. I don't know if these are exactly the figures, but when I put it out, and I know Phil didn't make a whole lot of changes, but for our overall DSS operating expenses, so there's no withholds this year from New York State, praise God. Yeah, you know, as you recall, the 20% holding never really was withheld. We ended up, all that revenue was ultimately paid to us. But between the 2021 and 2022 budget, we're seeking an additional $89,133 in local county share. Now, this is not Medicaid. Although Medicaid would not have added to this problem. But we're at 46.7.8 million for our budget proposed. We get about 33.7 million in revenue. And so our local share is at about 13 million. The bulk of that is services, that's foster care and adoption. Our numbers when it comes to our TANF and financial assistance safety net is slowly decreasing, has continued to decrease this year. So, you know, it's not escalating costs on that side of the house. It's escalating costs on the services side of the house.
Any insight on that? Why is TANF like so slowly decreasing? It sounds a little remarkable.
Well, I think it was all about
Additional monies, and who was qualified because of additional monies were paid out,
Yeah.
600.
You know, not all of our people receive full cash grants. Some of them really, I don't even want to estimate, but quite a few get partial public assistance.
Mhm.
They may work 30 hours a week. When they were booted out of the industries that closed down during COVID, and that's a lot of them, they actually made a whole
Right.
lot more.
Yeah, that occurred to me almost as soon as I said it.
Yeah, so they got kicked off of our benefits.
Yeah,
I expected to see an increase by now, but we're not.
right.
I think part of that is they're not going back to those lower paid industries because Amazon opened. Now I can make more money, you know? The warehouse is hiring again. You know, there's better
McDonald's
jobs
pays
out there. Yeah. McDonald's pays more, yeah.
Can I ask you, I mean, I guess we kind of skipped over this in the E&T budget. You have an employment advisor that's going to a senior typist, which is a downgrade of like $4 an hour. Is that correct?
Employment advisor, correct, that is correct. Somebody retired as an employment advisor.
Okay.
And the kinds of duties that person did can be covered under a lower level.
Okay.
So yes, that's under Rachel Pierce.
And the new position for senior accountant, you kind of touched on that a little bit, but.
The new, we have a new position for next year, but that's temporary, because from January to March, we'll have a senior accountant, hopefully, being trained by Bill for Bill's retirement in March.
All right.
Did you have something?
Yeah, when you're done, right?
Nope, go ahead.
So Stace, we talked a little bit, the reason I reached out and was curious to see a CPAC report is because I know CPAC makes recommendations on staffing levels and all different types of things. I guess I want to just quickly pick your brain on particularly with our caseworkers, right? We added a senior caseworker into this budget. Year before last, it all blends together, right? 2019, 2020. But in 2019, CPAC had recommended, I think it was right around 7 caseworkers. In that budget, we added, I think it was 2 or 3 in there. I guess I want to get kind of your opinion on where you guys at as far as staffing levels with caseworkers. I mean, we've always heard about high caseloads. We've heard about turnover. Are we at the point to where we're still not wanting to bring on more caseworkers because we're having a hard time filling the positions, or how do we feel, how does the department feel as a whole on where we're at with caseworker staffing levels? Do we need more caseworkers still? Is it an ongoing problem? I guess I'm just curious on where you guys fall on that.
It is of great concern to me that we went for a long time on a hiring freeze without hiring any caseworkers. And so now we are bringing in, a large amount. That is more of the angst and the issue. I don't feel like I have enough data to understand whether I need more, because I haven't been fully staffed. And then I haven't been able to see when people are actually up and running and trained as to where we're going to go with all of this. It's worrisome.
Yeah. So we don't have any sense of what caseloads would look like if that new wave, that once the hiring freeze got lifted and those new caseworkers were trained up and started and ready to be autonomous, right? We don't really have any sense of what that would do for caseloads as a whole yet.
I do not.
Okay.
I do not. What I can tell you is we're at pre-pandemic levels with all of our caseloads, in the services side of the house.
So what I won't be around in the new year, but what I would urge, certainly the committee and probably, maybe more of this committee gets it, but maybe the legislature as a whole, and I would encourage you as well, if you do get back to a point to where things are starting to take shape, and again, we have those folks working autonomously, we typically do this stuff through the budget process, right, as far as adding new positions. I would certainly, I would encourage you not to be bashful as far as for asking positions outside of the budget cycle, right? Because we know what this, again, this is me speaking, but sorry, Phil. But,
it's a little different than what I get in writing from Phil every day.
Well, for me,
I'm supposed to be bashful.
And
I thought I was really sticking my neck out with this.
I'm just saying, I've always looked at, and this is me, right? I don't have Phil's position, and I don't ever want it, but. But this is different than a caseworker is different than adding a department of motor vehicle or a a camp counselor or something like this, right? These people are dealing with the most vulnerable, at-risk population in our community, right? So in certain instances, there's not a lot of time to wait, in my opinion. So sometimes we have to work outside the norms of a budget cycle, because in certain instances it can be life or death, right? I mean, really, with some of these timely reporting and all of this stuff. So I wish you the best of luck in heading into it, but I would just say, and I pray for you that you guys, get to a point of sustainability with this turnover and with proper staffing and having people come off training and staying for a little bit, so you do get a sense of what you might need as a department. But if you find out 6 months into 2022, don't sit on it. I mean, I don't think we as a county have time to, in a lot of instances, with what those folks are dealing with and those cases that we're dealing with. So I guess I just wanted to pick your brain and put that on record for my own sanity. So thank you.
But that's exactly why we added the positions last year.
Yeah.
That followed
Added
exactly
positions
the caseworker positions.
2 years ago.
Yeah,
we didn't really have this kind of forum last year.
No, it was just.
I do want to say, going back to the new positions, please remember we get a tremendous amount of reimbursement.
Right.
That attorney gets 75% reimbursement. The senior caseworker, 62%. The senior typist and financial assistant, 75%. Senior admin services assistant, 75%. Director of financial assistance, that upgrade, 75%. Yeah, this isn't all county local share, so I just want to.
I would say that in finance and personnel too.
Yes,
I would definitely recommend.
Does that include health insurance?
No, not on this side of the budget, correct?
In the claim. It goes back to
In
the
the plan,
cap.
yeah.
It's in the cap.
Okay.
So that 62.63% we were adding to each person's salary for claiming. It's
Got it, understood.
Let's see.
So if that's true, real quick on this then, that means that we as a county though have saved quite a bit of money, right? If our actual, because we're self-insured, if our actual money spent is so much lower than we expected it to, which is the money which we come up with the 65%, that means we're saving money somewhere else. Because our actual claims, our actual payouts, because we're self-insured, are lower, correct? Is that correct?
I'm assuming that's in the cap that there's.
No, it has nothing to do with DSS.
Fringe benefits must have gone
If
down.
the fringe benefits percentage, Phil, so if we assume 63% in the cap, and our actual was quite a bit less, 50, what was it? 54%. That means that the only way that changes, we can't offer a worse benefit. What it means is our actual expenses went down, right? That's what we hire our actuaries to figure out, but I'm assuming if our actual.
Correct, I think that percentage, when they do that, it's different for every department.
Correct, it is
Yeah,
different. for
so there
every
may be
department.
departments that are higher than that 63 or whatever.
There will be departments that are
So
higher. there will
it
be-
fluctuates.
You know, the majority of our employees are at PSS, right, on average?
Well, it's not just about employees, don't forget, it's about retirees. as well.
Right.
Oh.
Independence.
But if those of our employees are at DSS, then most of our retirees are probably DSS too, right? We retire them way at the same rate, thereabouts.
Independence.
But I mean,
You know,
all things equal.
let me tell you, when I was a commissioner at Lewis County and our county administrator found out that we get reimbursement for retirees,
Everyone retires in DSS, right?
that's
It
what
just makes
she
sense.
wanted the last 3 years of everybody to be at DSS. But it's actually going the opposite way. You know, it was a 30-year employee that just went over to public health. So, that person, I mean, maybe we had one celebration 40 years. Maybe that person will be in public health for another 10 years. But yeah, we're the only ones that I know of in a county budget that can actually claim retiree health insurance. That's pretty cool.
Does it have to be 3 years?
For me to train somebody? Yeah.
We move somebody over to DSS for a while.
No, your retirement's based on 3 years, so I just thought that was a good mark. But yeah, it's pretty sweet for us to get there.
All right, well, how are we moving the DSS budget? Can we move it all as,
Yeah.
all as one, including adult and family services and all that?
States.
Okay.
Are you gonna ask?
Yeah, I need a couple of,
Addendums.
yes,
Oh, you got some changes.
I do. Veronica called me at 12:26 today. And if we go to page 121, books and periodicals. So these were subscriptions for Westlaw. I thought we were paying our subscriptions for Westlaw. Come to find out, we weren't being billed for all of them from county attorney. So now we've got to make up for this year. We got to up our, for next year to $12,000 from the $3,200 to $12,000 for 6 licenses, unless I get a new attorney, and then it would be $13,500 for 7 licenses. So if I could ask for them to be $13,500, I'm going to go on a wing and a prayer that we will get our 5th attorney.
It's in addition to the 3,200, because the Westlaw that's in there is the paper Westlaw, and the Westlaw that you're not paying for is this.
So we need to add $1,350. Okay.
And that's strictly,
So that would go up to $16,700.
and that's strictly based on the attorney's licensing.
Correct. Well,
Books and periods.
it's
Plus the books and
a
periods.
license in order to use Westlaw,
32 goes up.
which is like the major
No,
school and
okay.
our
It goes up by
paralegals.
13.50.
Yes, 13,500.
It's not a matter of we're paying for more periodicals necessarily.
No,
It's
no.
access to
At 13.
It's
Because some of the stuff, we've seen in other departments is a matter of, we don't need hard copies. We can
No,
get
they're
a
not.
much
It's
reduced
an online
license.
subscription for the attorneys.
Correct. That's exactly, yeah.
And what was that number again then?
So it would be,
16,700?
yes, 16,700 total. I
Okay.
think that came up in this morning's county attorney meeting, is that what I'm understanding?
Well, it's been going
I'll
back and forth.
make sure and check on that.
What's next?
And then the only other one is our gasoline costs.
Page.
It is page 130, and it's the third down, gasoline and oil. We had budgeted it for $2.75 a gallon at 4,000 miles a week. We're gonna,
No, 4,000 miles a year per
per vehicle.
for all the vehicles, yeah.
130, yeah. Page 130, yeah. 31.
So what's the new
4,000 miles is all we're doing it?
The vehicles are allowed 20,000 miles per year. They get, on average, around 20 miles per gallon. So the year is 4,000 gallons
Gallons, not
Of-
miles.
of
Oh.
fuel for 4 vehicles.
Okay, take that,
1,000
take it back. I knew we were going more than 4,000 miles in a year. Okay. We want to add $5,000 to gas because of the escalating gas prices. So instead of being 11,000, it'd be 16,000. And we did ask for one more vehicle in our budget. And that one more vehicle, we're figuring with the 3 vehicles we're leased right now, 3 vehicles leased, and one is the old mental hygiene vehicle.
Yeah, we have 4, and then I think you just have 2. And we're gonna
2
add
leased, and then we
We're
own
gonna,
this one.
and she wants it.
And so we figured we saved about $25,000 as a result of that during the 12-month year. 12 months, it wasn't a calendar year, but within 12 months. So that's good news that we were able to save money. And better news that, we knew it was going to be a tough sell. Some of our caseworker aides that were doing the traveling said, if you're not paying me mileage, I can't afford to work here. We pretty much lost them. Pretty much all have left. And now we have new people who came in and embrace their role and have a van and are fine with it. So, but
Is there another amendment, or is that just two?
That's in our budget.
Okay.
Yeah.
So, we already have a motion on the entire budget, so I'll move to amend, line A6010-542600 to 16,700. And line A6070-544200 gasoline and oil to 16,000 from 11,000.
I'll second it.
And somebody's making a note of that, so that this, perfect. Thank you.
Did you want me to read the numbers off again, Chanel? or-
No, it's fine, I have a budget book.
Okay.
Thanks, Cheryl.
All those in favor?
Aye.
Any opposed? Now to the entire budget. So, further questions? Okay, hearing none. All those in favor?
Aye.
Aye.
Any opposed? Thank you. Okay, I'm sorry I didn't ask your name earlier. What is
That's okay, my name's Elizabeth.
your- Hi, Elizabeth. You just, we try to rotate departments every month.
month. Sarah owes me for this one. Just saying.
We rotate every month so that everybody, we don't know who's gonna be first, or last, so that.
Well, I'm a whiner, so I'm used to my last.
So,
Always
Office of the
the
Aging happened to be last this time,
Mhm.
so I apologize for your huge delay, but you have the floor.
So I just have updates, that's all she gave me. She didn't tell me anything about budget. So just
Oh, okay.
for the updates, because she said she had emailed everybody. The Hannibal, the congregate meal site was opened on the 20th, and the Phoenix site was opened on the 27th of October. Parish will be opening next week on the 9th of November, and
48.
Mexico and Fulton are still in a grab and go status. They're not officially open for sitting down for meals for the congregate meal sites, but they're looking at opening by the end of the year, hopefully. Home delivered meals are on track for providing the 268,000 meals. Office for the Aging budgeted 267,000 for 2021, but they have received additional contributions, which will cover the cost of the extra 1,000 meals. Heat, we have received 299 applications through Tuesday, October 26th, of which 267 have been fully processed, batched, and sent to DSS for final review and approval, leaving us about 32 that we're still working on, still assisting. Health Insurance Counseling, aka HICAP, they have started open enrollment. They are currently booked, both of the counselors, until Thanksgiving. So there's very limited available appointments for open enrollment. So they are being directed to go to Medicare.gov if they have further questions. So they have been very busy. Santa for Seniors, this is our third Santa for Seniors program. We currently, as of this morning, I have 31 seniors nominated and 30 people willing to adopt the seniors. The deadline is next Friday, the 12th. We have another senior high-rise that's probably going to be, I'd say about 20 people they're nominating. So it's really successful. It really helps those seniors that are isolated or lonely and don't have any family at the holidays. They never meet their adopter. What I do is the presents come wrapped and we deliver the presents to them the week before Christmas. And her last thing she has on here is unmet needs. OFA had kind of submitted a contract modification to the county attorney for nutrition services. This is where Sarah would like to provide additional meals on Saturdays and Sundays for seniors who will be screened that don't have anyone to prepare the meals. And that would be done through not to exceed $37,000, I believe is what she has on here. And the last thing she has is with unmet needs, an RFP is being prepared for door-to-door transportation to our social adult day program that are ISIP, which is our elderly in-home service program. So we do have many seniors that are on a waiting list right now because we do not have any available aides. So this would be a way to combat some of that waiting list. I believe there's around 70 people on that senior home care waiting list waiting for services. So this would give them a way to get to transportation for social adult day, which is located in Baldwinsville. So she is working on that RFP, and that's all she gave me. Sorry, I'm trying to be as quick as possible.
That's okay. If you want to elaborate on anything, you can. You've already been here this long. Um,
Okay.
Okay, so, any discussion on the OFA budget?
I move it for discussion.
Second.
All right, got dueling seconds.
So,
I went over, you know, to a degree with, Sarah on the phone, so, I have no questions.
I don't either.
you said she mailed, changes or whatever?
She mailed us, yeah, I think she copied everybody the actual budget. And, but maybe she did not, I think she made it clear in the email she wasn't gonna be here. I knew ahead of time clearly, but,
I mean, the budget doesn't reflect much difference. I think there's a $2,000 increase. We did we upgraded the position titles last year, I think, right? So, I mean, I don't have any questions. Liz does a good job for him. She runs New York Connects, right?
Yep,
Liz?
I'm the Senior Aging Services Specialist, so I do New York Connects, the Caregiver Services Program, and all the public outreach and education as well.
So she runs some great programs publicly, and you do a lot of stuff around the holidays for food collection.
All of
things
our
like
extra
that.
things we do. We are also gearing up for our Christmas card that we write to homebound seniors, which last year was 645 that we administered in the county to homebound seniors between the nursing homes, the assisted living, and I write them all out on Thanksgiving. So if you want to donate cards, I'll take cards from you.
We should put you on tune. Sorry.
okay, well, all those in favor of the OFA budget?
Aye.
Any opposed? Thank you. I will look for the appropriate motion.
Move to adjourn.
Second.
All those in favor?
Aye.
Thank you all.